Yeah, my name's Andrew Meads. I'm employed by Pegasus Health as Medical Director for the Acute Demand program. I'm also an urgent care doctor. I work at 24-hour surgery urgent care centre as well. Acute Demand is essentially an admission avoidance program. It's based in general practice primarily, although it has other functions that it does. It started in general practice about 15 years ago by Pegasus Health. Primarily, Acute Demand reduces admissions by wrapping support around the patient within general practice. So GPs can organise what we call a package of care that's can go for up to 5 days. And within that time, they can provide any kind of support that the patient needs. That can be medical, nursing, social support. We can also do diagnostics, labs, imaging as required. Essentially anything that's required to get that patient out of hospital.
Hi, my name is Debbie Marsden. I'm the nurse team leader for the Acute Demand nursing team. We're a group of nurses that are based at the 24-hour surgery, and we provide care for patients to be managed safely in their home rather than going to hospital if appropriate. The Acute Demand nursing team work very much as a team. It's a great group of nurses that work in the service. We're well supported by the doctors in the service and at the 24-hour surgery, and we all work really well together, work really closely together, and fantastic place to work.
My name's Trish and I'm a registered nurse with Acute Demand. I have been with the service for almost 2 years, and before that I worked in the hospital and a variety of different areas of nursing. Within the service I've got 2 roles. One is working in the nursing team, and we see patients both in the community and in clinic in our rooms, which are just above the 24-hour surgery. And I also work in coordination, so as one of the nurse coordinators. So that's in like a little mini call centre that we have, and we take calls from GPs and a variety of health professionals just on a day-to-day basis, and that's really dealing mainly with the more broader area of Acute Demand, which is an organisation which is funded by the CDHB, and it doesn't just deal with seeing patients per se, it deals also with helping GPs and practices to keep people out of hospital. Personally, what I enjoy is the fact that I've got dual roles. I enjoy the coordination side of things because it's more of a clerical troubleshooting type of role, so you get the opportunity to do quite a lot of problem solving. I mean, it can be quite straightforward as well, but you never quite know what's coming on a day-to-day basis. And I really enjoy the nursing role as well, having contact with the patients and seeing them both in their homes and in the clinic. Well, we work very much as a team. We do work individually though, so we have our own caseloads. So we have a list of patients at the beginning of the day which we know that we're timetable to see, and we do see those individually, but we work together a lot as well because obviously we're covering the whole of Christchurch. There's only ever 4 of us out on the road at the same time, so it's a wide area to cover, so we have to work in with each other in terms of who sees who to make sure that we get everyone seen. Also, if we have issues with complex and challenging cases, we might see those together. We talk a lot to each other about what we've seen during the day, what we each think about things and how we deal with things, along with our medical directors as well. And yeah, so it's very collegial.
In the past, the bulk of the work has been skin and soft tissue infections, but now we're doing less of that and supporting people at home with chronic long-term conditions such as heart failure. The nurses often bring people into a clinic-based setting to give intravenous antibiotics, but sometimes they'll go out and do that at home. And we support them medically by being able to go and review the patient with them at home or in the clinic. But at the same time, the nurses work very autonomously. They make decisions about whether to continue the treatment or discontinue the treatment, and we support them to work in that way.